And they hear you.
No. And you can also show the picture. We don't have to like appear on. Good morning, ladies and gentlemen, and welcome to our press conference. We are happy to have you here at the press room of the European Center for Disease Prevention and Control. And we also have our colleague joining from the press center in Copenhagen. My name is Andrea Horvat-Kramaric, and I'm head of communication and spokesperson, and I will be moderating this press conference. And today we mark the World Tuberculosis Day, and we centered this press conference on the topic of tuberculosis and the release of a new joint ECDC-WHO surveillance report on tuberculosis surveillance and monitoring in Europe and European Union, European Economic Area. For that purpose, I have today with us here ECDC Director Andrea Ammon, as always. We have at the WHO Regional Office for Europe, Unit Lead, Joint Infectious Diseases, Stela Bivol. And we have here ECDC Head of Sexually Transmitted Infections, Blood-Borne Viruses and Tuberculosis, Marieke van der Werf. Before we start, just a few words on the housekeeping rules. So please, when we have our speaker's address, stay muted. And when the floor will be open, please raise a hand and or write your question in the chat, and I will read it. And please, if possible, indicate who would you like to receive an answer from. If not, we will see who is the best fitted to answer. This press conference is being web streamed, also put on our YouTube channel afterwards. So I believe we are ready to start. And without further ado, I give the floor to our director, Andrea. Andrea, the floor is yours.
Thank you, Andrea, and good morning to all of you. Thank you for joining this press conference to mark World Tuberculosis Day in 2023 and the release of our joint report with the WHO Regional Office for Europe on tuberculosis surveillance and monitoring in Europe, the 2021 data. Well, Tuberculosis Day is observed on 24th of March every year around the world, and it marks the announcement of Robert Koch 139 years ago in 1882 that he had discovered Mycobacterium tuberculosis as the causal agent of tuberculosis. The goal of the World TB Day is to raise awareness about the global burden of tuberculosis, status of tuberculosis prevention and control worldwide. Report that, or the data that we're presenting today, are of course for the European region, and I will focus on the EU/EEA countries, and Stela Bivol will more refer to the region as a whole. So through our joint surveillance, we always take stock on the progress that we are meeting the Sustainable Development Goals on health, which aims to eliminate tuberculosis as a public health threat by 2030. And this means concretely that compared to 2015, in 2030, we have a 90% reduction in deaths and an 80% reduction in the tuberculosis incidence. So in 2015, when the SDGs were agreed, countries endorsed the goal to end tuberculosis in 2030. And in September 2018, 2018, global leaders agreed on ambitious targets to be achieved by 2022 as a medium step. These goals from 2018 include increased access to tuberculosis prevention and treatment, increased funding for both tuberculosis services and research to accelerate the progress towards the 2030 goal. So where are we now? The surveillance data that WHO and ECDC published today indicate that the progress to end tuberculosis has stalled, even been reversed to so the targets set in 2015 and in 2018 have not been achieved. And there are multiple reasons for that. Consecutive crises like natural disasters, conflicts, and of course the pandemic have severely impacted health systems and jeopardized the progress that we have already made. Mostly the COVID-19 pandemic has derailed the progress towards ending tuberculosis, along with many other health priorities, and continues to have a damaging effect on the burden of tuberculosis. The ongoing war in Ukraine has caused an effect, triggering an escalating humanitarian crisis in Europe with direct and indirect impacts on people's lives and health, as well as on the Ukrainian health system. And as a consequence, there is a risk of increased HIV and multi-drug resistant tuberculosis infection rates in Ukraine and in other countries due to the population movement and the limited access to diagnosis and treatment. So in 2021, the overall tuberculosis notification rate in the EU-EEA countries continued to decline. But what we are seeing is not enough. We have, in the last 5 years, an annual decline of 6.8% per year. But what we would need in order to achieve the notification rate of a 80% reduction in 2030 is 11.7%. And although this represents a continuation of the downward trend, recent years have to be seen also in the context of the COVID-19 pandemic and the challenges it created for tuberculosis clinical services. At the current rate, the EU-EEA will not achieve the 2030 Sustainable Development Goals for tuberculosis. And the patterns and the trends vary widely within between the countries. Due to, as I have mentioned, the impact of the pandemic on health systems' capacity to prevent, diagnose, and treat tuberculosis. So while most countries in Western Europe appear to be on track for tuberculosis elimination, Eastern European countries continue to experience a high burden, particularly of drug-resistant tuberculosis. Overall, the treatment successes remain well below the targets, and my colleagues will address this further. So good treatment options are available, but the success rate still is below the region in the regional target of 85%. There are some pieces of good news. So in the EU-EEA, the incidence of tuberculosis is low. 24 of the EU-EEA countries reported less than 10 cases per 100,000 population, with the target notification being 2.4%, which constitutes the 80% reduction I mentioned earlier. So these countries are, of course, encouraged to maintain the low rate and even diminish it further and go beyond the 2030 global target already now. The notification rates for drug-resistant tuberculosis are also very low in the EU-EEA countries. with only 630 cases reported with multi-drug resistant tuberculosis, and around a third of them was reported as pre-extensively drug resistant tuberculosis. So the challenges are enormous and they demand a determined response. So to get back on track, we need revitalized and urgent political and financial commitment and an agile and adapted response to tuberculosis. We need specific actions in order to regional and global targets, such as case finding increase, an increase in tuberculosis preventive treatment, people-centered approaches, and support people with multi-drug resistant tuberculosis in completing their treatment. Furthermore, we have shorter and oral treatment regimens for drug susceptible and multi-drug resistant tuberculosis, but their availability has to be improved. So later this year, on the 22nd of September, world leaders will participate in the follow-up high-level meeting on tuberculosis as part of the UN General Assembly to commit to new targets and set new milestones to end tuberculosis. But these new commitments need to lead to action and accountability at all levels to ensure equitable progress and access to prevention, testing, treatment, and care to fight the stigma and discrimination that is affecting some of the most vulnerable people. We had success, and if we are serious in ending the TB epidemic, we have to step up our efforts now. Thank you.
Thank you, Andrea. And now we go to the Copenhagen studio of WHO Regional Office for Europe. We go to the unit lead infectious diseases, Stela Bivol. Stela, you're online and you have the floor.
Thank you so much. Greetings from Copenhagen, the home for WHO European Region Office of WHO, covering countries, 53 countries across Europe and Central Asia. A region where ending tuberculosis remains unfinished business, yet a region that has the know-how how to end TB. Prior to the COVID pandemic, the European region was on a good path, with the fastest decline in TB incidence and mortality in the world. Numerous crises contributed to reversing the gains. The regional data in the Global TB report shows a grim reality check. The number of deaths increased in 2020 and 2021. We had a big drop in the number of people newly diagnosed with TB and reported, and a much slower recovery compared to the rest of the globe. The gap between the number of people falling ill with TB and the number of people diagnosed is increasing. The estimated number of people developing resistant strains has also increased. Yet, these are remarkable times for those of us working on TB. For the first time in the history of tuberculosis, we have treatment regimens that are just 6 months long for both so-called regular TB and drug-resistant TB. Just imagine, we can confirm a diagnosis of TB and drug resistance within hours and start treatment at once. A few years ago, we probably would not have thought this possible. We must take full advantage of new technologies. We have the scientific and medical tools to recoup lost ground. Treatment success exceeds 85% with the use of shorter, fully all-oral regimens for MDR-TB in the regional operational research that is led by WHO Euro in 13 high-burden countries. Before, it was 57. This is a game changer. Digital health solutions, video-supported treatment, innovative people-centered service delivery approaches are widely introduced and are reshaping the TB response. Uptake of the recommended by WHO rapid molecular diagnosis is one of the highest across all WHO regions. Multi-sectoral action accountability can combat tuberculosis. Social vulnerability, tobacco and alcohol use, HIV are among the key drivers of the tuberculosis epidemic. Collaboration, action, and accountability across sectors helps to end TB. The region is also ahead of the curve in engaging civil society and affected communities, who are first responders in times of crisis too. But we urgently need stronger, consistent, invested partnership between member states, donor agencies, and affected communities if we are to reach everyone living with TB with the treatment and care they need. September 2022 saw a renewed political commitment for ending TB in Europe. At the 72nd meeting of the WHO Regional Committee for Europe, when member states endorsed the 2023-2030 TB Action Plan for the WHO European region. 2023 is a critical year. This September will bring the second high-level meeting on TB, which is co-facilitated by Poland and Uzbekistan, both WHO Europe member states, a real honor for our region and an opportunity to step up regional leadership. We should show exemplary mobilization of heads of state and health leaders alike to take the decisions that will turn the tide in the global TB response to TB. Yes, we believe we can end TB, and we can end it together. Thank you.
Thank you, Stela, for this address. And now we come back from Copenhagen to Stockholm, to ECDC, to the head of sexually transmitted infections, blood-borne viruses, and tuberculosis, Marieke van den Berg. Marieke, the floor is yours.
Thanks. Good morning. I would like to supplement Andrea's comments by providing additional technical details to the report that WHO Europe and ECDC are publishing today. And I will focus on the data that relate to the European Union and the European Economic Area. The report that we launched today presents 2021 data. In 2021, 33,520 people were diagnosed with TB in our area. These are amongst the almost 200,000 incident TB cases diagnosed in the wider European region. For the European Union and the European Economic Area, this means that there are 7.4 TB cases diagnosed per 100,000 people. The notification rates, so that's the number of TB cases per 100,000 population, ranged between 1.9 and 41.6 in the different countries, and that shows a 20-factor difference in the notification rate. 24 countries have a notification rate below 10 per 100,000, and 16 of those even below 5 per 100,000. Thus, these are approaching the pre-elimination target of less than 1 TB case per 100,000 population. As said by Andrea, the good news is that the overall number of cases and the notification rate has decreased over the last 5 years in almost all countries. Especially between 2019 and 2020, we saw a sharp decline in the number of cases. The latest data, the 2021 data, however, show increases in the number of cases in many countries. This sharp decline and subsequent increase should be interpreted with caution, since it was observed in the years of the COVID-19 pandemic. The measures implemented to mitigate the COVID-19 pandemic may have had an impact on TB data collection, but also on access to health services. And therefore, we will need to wait for the data from 2022 and onwards to see the real impact of the COVID-19 pandemic. Andrea also mentioned the ongoing war in Ukraine and the potential for increases in the number of TB cases in our area because of the higher incidence of TB in Ukraine and also the higher proportion of TB patients with drug-resistant TB. The data that we're presenting today are from 2021 and therefore do not yet allow us to see the effects of the humanitarian crisis in Ukraine. We will follow this carefully next year when we will analyze the 2022 data. Multi-drug resistant TB was not frequent in the EU-EEA, with only 3.8%, 630 cases of all TB patients that were tested for resistance showing resistance. This is good news, and further good news that was already said by Stela is that the duration of the treatment is now shorter. It's with the shortest option being only 6 months, and that is the same as for drug-susceptible TB, and much shorter than it was because it was more than 18 months. This shorter treatment regimen has the potential to substantially increase coverage and treatment success, and that's what we need. We need that because the treatment success is low at the moment. The success rate is low, especially for MDR-TB. Of the 781 MDR-TB cases notified in 2019, there were only about half had a successful treatment outcome. Treatment outcomes were significantly better for TB patients without drug resistance. Of those, 72% were treated successfully. But both for drug-resistant TB cases and patients without drug resistance, the treatment success rate was below the regional target of 85%. In 2021, we had 21 countries reporting data on HIV co-infection. Thus, for 9 countries, we do not have information about this important co-infection. If we look at the data that were reported, we see that of the 12,837 TB cases with a known HIV status, 4% were reported as HIV positive, which is 510 cases. And this number decreased from 2017 when 870 reported. Let's finally look at patients with pre-extensively drug-resistant TB. Those are patients that are resistant to the best drugs we have, and they would therefore need to be treated with much more complicated regimens and more expensive drugs. In 2021, 115 patients were diagnosed with pre-extensively drug-resistant TB, and this number has decreased over the past years. For example, in 2017, it was more than twice as high with 288 pre-XDR TB cases reported. If we look 24 months after the start of treatment, we see that only 17% of the pre-XDR TB cases had finished their treatment successfully. And many of them were even 24 months after treatment initiation still getting treatment. In conclusion, the surveillance data show us where progress has been made and also where further work is needed. It also shows that TB is not a disease of the past. To make that happen and to reach the targets, action and accountability at all levels is needed. To ensure this equitable access to prevention, testing, treatment, and care, and to fight stigma and discrimination that is affecting some of our most vulnerable people. And I realize by saying this, I'm mostly repeating the final Andrea, and I do this because this is my most important message. Thank you.
Thank you, Marieke. With this, we close the part of our address and we open the floor for the questions. And we already have one in the chat and I will read it. So it's from Miriam Martin, Deutsches Ärzteblatt. Why isn't there data from 2022 yet? So maybe we have Marieke to answer this.
Yeah. At the moment, the countries are still working on their 2022 data. They need to validate them and they will only start sending it to us from May, June onwards. And some countries need until the end of September to be able to have the complete data set available and to be able to send it to us. Of course, this is rather late and we're working with the member states to get these data earlier. And we hope that when we get more to digital surveillance and also more to digital surveillance with the data directly sent to ECDC, that this can go much faster, because as sooner you have the data, as better you can see what actions are needed.
Okay. And we already have Sarah from Politico. So Sarah, please go ahead and ask a question.
Hi, thank you so much for this great presentation and interesting report. I have two questions, please. The first is just that I'm wondering, when I was reading the press release, it noted that the mortality, TB mortality had gone up, but then upon digging further, as I understand it, the report mortality figures focus on HIV negative mortality figures, and so it kept saying that the TB mortality had stalled. So it was a bit unclear to me, had it gone up, had it stalled? In short, I just want to know, why was the mortality for all TB patients, HIV positive and negative, not included in the report? And then the second question is, there's also a note in the report that the incidence rate of TB had gone up in the WHO European region by 1.2% in 2021 compared to 2020. I'm just wondering if you could comment on what exactly that means. Thank you.
Thank you, Sarah. And for the first question, we would go to WHO. So Stella, if you can take the first question, and then we will have the second one.
Yes, thank you so much for the question. Indeed, you already mentioned the reason for the discrepancy between the press release and the statement that is done in the report, because it's related to the HIV negative mortality that is included in the report. At the same time, the disease burden estimates are produced by WHO, which includes more disaggregation by different population groups, including HIV positive mortality. And this is not presented in the report because of consistency of how data is presented over the years. The estimated HIV positive mortality increased from 7,000 in 2020 to 7,300 in 2021, and that is the reason behind the statement. Obviously, the most probable cause is the poor TB treatment outcomes among the people who are TB HIV co-infected, and this is due to late detection of HIV simultaneously with TB. So the report includes mortality data for HIV negative people, and indeed from in both 2020 and 2021 it was around 20,000, and it has stalled for the first time in the last 20 years. So I hope I answered the first question. And in terms of incidence, increase in incidence mortality, incidence rate in 2021, this is an increase in notified incident cases, which is the reported number of cases, not the estimated. What we would like to see is actually a larger increase in notified cases after COVID, because what happened during COVID pandemic was that a number of people did not come to services, or services did not reach to them. So there's more undiagnosed TB in the community than was reported. In the rest of the WHO regions, this increase in notifications in 2021 was larger than in the WHO European region. So our interpretation for that is that there is no proactive case finding happening at the pace that needs to be happening, so that we pick up and get back on track where we were before COVID pandemic. Hope I answered the second question as well. Thank you.
Thank you, Stella. Sarah, if this is okay, let us know if you still want some additional questions. But for now, we have a question from Mose from Brussels Times. So Mose, please go ahead.
He's muted.
If you could please unmute yourself, Mose.
Okay, sorry. Okay, to hear me now. I just wanted to say that it's quite difficult to interpret the figures, and the picture quite complex. But I would like to focus on one overall question, and that is, let's say, the basis for this very, as you say in the press release, very sobering or dire warning that it's not likely that the targets, the goals, will be achieved by 2030. And why? Because I got the impression that the main reason for let's say, the problems now or the increase in rates is after all the COVID pandemic, when of course there were limited access for treatment of other diseases and so on. And so now when the epidemic is more or less over, at least we have returned to normal, is there not, let's say, a chance that things will become better? And especially now when there is this access, as you mentioned, of more effective and shorter treatment. What is your comment to that? Thank you.
Thank you. Our director, Andrea Ammon, will take this question.
Yeah, thank you for the question. And indeed, there is, of course, there is an opportunity and a chance to still get back on track. Our appeals are more in the direction that we have to step up the efforts right now in order to get where we left before the pandemic. And even then, we were already aware that we had to intensify it. For instance, increase the speed of the annual decrease that we have. That was already the case before the pandemic. And now it's even, we have to increase this decrease, increase the decrease even more. So I think we have to do a catch up, and that is what we want to bring to the attention if we want to still reach the goals. But it is still possible, of course it is.
Thank you. I hope the question has been answered. Do we have more questions? Please raise your hand. Maybe in the chat? No? Okay.
There are. It's indicated somehow.
Still waiting for questions. If you have any, please put them forward.
Andrea, maybe if I can supplement a bit on the challenges, if there are no other questions.
Well,
there is one question from Sarah still. So, and we have one now in the chat, but I will give the floor to Sarah.
Hi again. Sorry to be a little bit, I just want to be clear on the terms that are used in the definitions. I saw that in the report it said that Romania had the highest, of the EU EEA countries, Romania had the highest notification rate among kids with 9.2 per 100,000 people aged up to 4 years old. Just wanted to clarify again, is notification rate just the number of cases per 100,000 people? Is that literally what it means? Like it's the actual number of diagnosed cases, not an estimated cases. I'm always a little bit unclear when are we referring to actual cases versus estimated cases. If you can just clarify that in the report, please, that would be lovely. Thank you.
Thank you for the question. I believe Marieke can take this one.
Yeah. Thank you for the question. If we talk about estimated number of cases, then it's the incidence. And in the report, it's the first two tables that have estimates. And those are developed by WHO, and they use a whole system. Maybe Stela can say more about it to get to the best estimates. The other things, the other numbers in the report are notified by reported by the member states to ECDC and WHO. So those are actual cases that were diagnosed that are in the systems of the member states, and they really exist, so to say. We believe that in the EU EEA, and we've done studies about that, that the difference between the estimated number of TB cases and what's notified is not so big, because that are found and in the end reported. Thank you.
Thank you, Marieke. If you would like to comment at any point, please let us know. We have yeah, go ahead.
Yes, thank you. I wanted to come back to the challenges in the WHO European region, and mostly on the eastern side of it, non-EU, non-EEA part, and what are the key challenges that do not allow us to get back on track as fast as we would like to. As Andrea already mentioned, that there are discrepancies between the East and West in the region, and one of them is the high MDR TB burden. And the treatment outcomes for MDR TB were not as good as we want them to. It's 57%, and the target is 80%. But we do have now hope because of the new treatment regimen that we will get to those great treatment outcomes, and it will allow us to reach the targets on MDR TB. The second big challenge is the high TB HIV co-infection burden, especially in the eastern side, and 84% of it comes from the eastern side, and that means that again the outcomes are much poorer, and also people come late in service who have a late disease for HIV and also late disease for TB. And that means that during that time, they transmit to others in the communities as well. And that also makes the challenge of finding people on time, finding them early, and putting them on treatment early. And this is the key, let's say, priority area now after COVID, to catch up, to find the people who have TB and who remain undiagnosed, and get them on treatment successfully. And finally, in order to really reduce the TB incidence, we have to treat people who have TB infection. And for that, we need to scale up TB preventive treatment. And unfortunately, in the WHO European region, we have not done as well in scaling up this TB preventive treatment. And this is one of the targets we are quite behind. And this is, again, a key priority for the next period, to scale up TB preventive treatment in people who have TB infection. Regarding the difference between notification and estimates, indeed, WHO uses a methodology to estimate, and it's a modeled estimate of disease burden that allows to understand the difference between what is estimated to have in the country in terms of TB and what the actual reporting shows, and that is the range in which we need to work to get as close to the estimate as possible. Thank you.
Thank you, Stella. We have another question, so I will read it. It was posted in the chat. It was from Tim from Bloomberg News. So globally, is there any indication that TB will pass COVID-19 as the leading cause of death from infectious disease in 2022 or 2023? So I would give the floor to Andrea, to you maybe, Marieke. Thank you.
Yeah, it's a good question, but it also depends, of course, on what COVID-19 will do in 2023. And on global, I don't have the COVID-19 global figures at hand, so I can't really answer it, sorry.
Okay, so maybe keep this question for the next year. I have another question coming from Moses of the Brussels Times. How is TB transmitted? So maybe Marieke would also want to take this one.
TB is a respiratory disease mainly, so it's transmitted by people who are infected, who are infectious, who have lung TB, and then by coughing, sneezing, or even loud talking, they will. It's a bit like COVID. They will get the bacilli out, and if you then, especially if you're in an area where you've close contact with people with infectious TB, you have a chance of becoming infected. So also what kind of helped for COVID-19, distance and face masks, should also have helped for TB. And that makes it interesting to see how the TB data will look in the coming years. I hope that answered the question.
Thank you, Marieke. Do we have any more questions? For now, I don't see it in the chat. I don't see any hands. Okay, so you're telling me that this is, okay, Sarah, I see another hand. I hope this is the new one, so please go ahead.
Yes, it is. Sorry. Very last clarification. I just want to be clear that we're basically what the findings show from the ECDC and the WHO Europe is that TB deaths in Europe increased in 2021 for the first time in nearly 2 decades because of like the COVID disruption to services. Is that correct? I'm seeing Stella nodding.
Yes, it's accurate statement. It could be further detailed, but it's an accurate statement.
Okay. And then just to be, again, because of the different epidemiology terms that I don't use every day, but the warning is really that because there's an overall though there is an overall downward trend in the number of TB cases in the last few years in the European region, the rate at which it's going down isn't fast enough to meet that goal by 2030. Okay, super. And I'm all done. Thank you. Sorry about that.
And I have also Marieke wanting to compliment a bit. So Marieke, go ahead.
Yeah, if we look at the trends in the EU EEA, we see maybe a few hundred more cases in 2021 compared to 2020. So I wouldn't say that that's really an increase in the EU. It's more stable, and we hope that the downward trend that we've been observing for many, many years will continue in 2022.
Thank you, Marieke. Do we have more questions? Okay, so now you're telling me that this is it. I would like to thank first our speakers, our director, Andrea, Marieke van den Dev. I would especially want to also thank our colleague in WHO Euro studio in Copenhagen, Stela Bivol. And thank you for participation. Thank you for following us. Please, if you have any questions, write to our press office. And just to say that today we also released a podcast on tuberculosis on all of our channels. So if you have any questions or anything, just please come to us. And then until some other opportunity, stay healthy and goodbye from Stockholm and Copenhagen, I guess.